Hi everyone, my name is Shirley Becker. I am a student doctor, just a few months away now from being a real life doctor. Welcome to or welcome back to my channel. I studied medicine here at the University of Cambridge, and sometimes I make videos on topics within women's health medicine. So today I thought it'd be a good idea to make a video discussing fertility or infertility. Infertility can be a really scary topic for a lot of women. Before I discuss some of the causes and investigations for infertility, I really want to say a few words on sex education in the UK. Sex education in the UK is very much delivered through scare tactics. So I was born and partially educated in the Netherlands, but received much of my sex education here in the UK. As long as I can remember, I've been taught, do not have sex, or have safe sex, or you're gonna get pregnant. And I think that if they make pregnancy sound like such an inevitability as a result of having sex, I think without really discussing things like infertility and how common it can actually be, it leaves us with a population convinced that when they finally do have unprotected sex with the intention to get pregnant, this should be something that comes very easily and quickly, when in reality, it can take people a really long time to successfully get pregnant. And so I think that's really an indication and a place to discuss topics like this. So let's first of all make sure that we're both on the same page. So infertility is defined at a point where a couple fails to acquire a pregnancy within 1 year after having regular sexual intercourse. So when it comes to the NHS, which is a free healthcare system we have in the UK at the moment, they will investigate for causes of infertility if that couple have been having regular sex for at least a year if the female's under 35, and at least 6 months if the female's over 35. Once a female's over the age of 35, the chances of conceiving a pregnancy go down compared to females under 35, which is why there's a slightly shorter attempt requirement. So now let's talk about the causes. So there are lots of different causes to infertility. Remember, infertile doesn't necessarily mean that someone cannot and will never have a child. It means that there's some kind of struggle to conceive naturally. And actually it's very common. 1 in 7 couples will struggle to conceive naturally. If this is you, if this is something you're worried about, this is something you're completely not alone in. It's actually so much more common than people appreciate or realize. It's useful to think about all the steps that are required to conceive a pregnancy, to start to imagine different places in which this might go wrong. For the purposes of this explanation, I'm going to discuss a male and female naturally conceiving a pregnancy. We need a male and a female who are having sexual intercourse. Sperm to be released from the testes, ovaries that are able to release eggs. We need the sperm and the egg to eventually meet in the tubes of the female. We need healthy tubes. And then we need the healthy embryo to be able to make its way down back into the womb, implant itself for the eventual fetus and baby to grow healthily. So you might have noticed that I described that in a little bit more detail than we just need 2 people to bang. That's because all of those details are areas in which things can potentially go wrong and give rise to people struggling to get pregnant. So I'm going to break this video down into those different areas. So problems can arise when it comes to sex, male fertility, female ovulation, and female structural abnormalities. So let's talk about sex, or rather sexual effectiveness. Are we having effective sex? So 84% of couples will conceive naturally within the first year of having regular sex. But it's really important to remember that the sex does need to be regular and effective. So a couple is considered to be having regular intercourse when they're having intercourse every 2 to 3 days. As we know, there's actually a small window within every cycle that is considered to be highly fertile. Oftentimes what you get women doing is reduce their sexual intercourse to this window, or at least they're ensuring they're having sex during the times that they're said to be highly fertile. This is actually not recommended, and the reason it's not recommended is not because it's ineffective or not true, but it increases the stress that surrounds the attempt of getting pregnant, and actually the stress and stress hormones can interfere with successfully conceiving itself. The advice is actually just have sex every 2 or 3 days rather than becoming very methodical and stressed about it and not enjoying the process, just because that stress can interfere with fertility sometimes. Let's talk about male infertility as a contribution to a couple struggling to conceive a pregnancy. Although I feel like when it comes to the word fertility, a lot of people look to women, in actual fact, 30% of all struggling couples are struggling because of male infertility. So I think there's really some indication to take the load and pressure off women and recognize that actually sometimes the issue lies with the male partner, what we're really discussing is whether they have good quality sperm to conceive a pregnancy. When a male ejaculates, there's a kind of whitish fluid that ejaculates from the penis, and not all of this is actually sperm cell. In fact, most of it is not comprised of sperm cells. There are a lot of fluids that house the sperm cells themselves. So this diagram over here demonstrates what we mean when we say sperm count or sperm concentration. On this side, you can see that the sample contains lots of sperm cells within the fluid, and on this side you can see that there's actually a reduced number of sperm cells. When someone has a low sperm count, it can obviously make it more difficult to conceive a pregnancy, because one of these sperm have to fertilize an egg. The more sperm there are, the more chances of fertilizing an egg. This diagram shows what we mean by sperm morphology, or the shape of the sperm. So this is a nice and normal, healthy sperm cell with a good normal tail and a good normal head. And here you can see that there's actually defect in the head, and the tail shape is not normal. And when this happens, it means that the sperm is essentially not really that viable. This diagram here shows what we mean by the sperm motility. When we refer to motility, we're talking about, are the sperm cells good swimmers? So the tail is supposed to move in a kind of spiral formation that allows the sperm cell to propagate upwards in one direction. It needs to go up the vagina, so the tail, a healthy tail, allows the sperm cell to do that. On this side, we can see that the sperm cell does not have a normal tail attached to it. What it's causing that sperm cell to do is to propagate in sort of a slanted direction rather than vertically upwards, and this makes it just a lot less likely for it to actually meet an egg cell. So let's discuss ovulation. In order to conceive a pregnancy, a woman's egg has to be released in order to meet a sperm cell. In some cases, there are problems with this, and this can be further broken down into two problems. Too few eggs left, and that's why there's a problem with ovulation. Or is there an actual problem with releasing the eggs that the woman does have left, despite having more than enough eggs left? So a woman is born with all of the egg cells she will have for her entire life. So as she ages, the number of egg cells that are available go down. And this is why when a woman gets older, the chances of getting pregnant become reduced, because her ovarian reserve has reduced. This depletion is normal as we go with age. In some cases, some people's ovarian reserves have depleted at an abnormally fast rate compared to other people. So here you can see an example of ovaries that contain a normal number of egg cells compared to here, where there is a reduced number of egg cells. And this is when we consider someone to have a low ovarian reserve. In some cases, actually, some people have a high ovarian reserve and they actually have a higher concentration of egg cells in their ovaries compared to what's considered normal. And this is linked to conditions like PCOS, but we'll come back to that a little bit later. There are a few ways or tests that we can do to investigate this. We can look at your hormones, FSH and AMH. And this is a hormone that's picked up in your blood. So let's talk about FSH. So FSH is a hormone that is released by the brain that stimulates your ovaries to release an egg. So if your body knows that there are lots and lots and lots of eggs available, then your body knows it only takes a little bit of FSH to send down to your ovaries to stimulate those many eggs to release at least one. If your body, on the other hand, knows that actually there are only a few eggs left, so we really need to send a powerful message down to get at least one of them to be released, then your body will release lots and lots and lots and lots of FSH to get the ovaries to be stimulated. When we do a test and we see a very, very, very high FSH concentration, this might be an indication that your body is doing that because it knows that there are fewer eggs left. AMH is something that's released by the egg as it's maturing. We can use this as kind of a direct measure of how many eggs are left. The more AMH is left, the more maturing eggs we have, the more eggs that are left. When AMH is low, it means that there are few maturing eggs, and so there are few eggs left. We can use those numbers in combination to suggest that someone might have a depleting ovarian reserve. The alternative thing we can do is to actually ultrasound image the ovaries directly. Ultrasound probe can be inserted into your vagina, which is a bit closer to the ovaries, and we can just look at the ovaries. In some cases, we actually have a healthy number or even a high number of eggs left in our ovarian reserve, but for some reason we're not releasing those eggs. And this can be due to a hormonal problem. First one I'm going to discuss is PCOS. So polycystic ovarian syndrome is a syndrome that can occur in some women where they are not ovulating regularly. And there is a triad of symptoms that kind of defines polycystic ovarian syndrome. First of all, oligomenorrhea, which essentially means that a woman is not ovulating or ovulating fewer times than what is normal. And this manifests as irregular periods. And when I say irregular, I don't mean that one day your cycle was 27 days, the next time it was 30 days. That's normal variation. What I mean is within a year, you're actually not having very many periods. The second part of the triad is hyperandrogenism. And hyperandrogenism essentially means that you have lots of testosterone in your body. So signs of high levels of testosterone can include hair growth that we expect in males, so hair growth along the jawline, and there are other symptoms that manifest as a result of having a high level of testosterone, very oily skin, very acne prone skin. The third part of the triad is a polycystic appearance on ultrasound scan. What we mean by this is if someone does an ultrasound scan and we look at the ovaries, it appears that there are multiple cysts in the ovaries. Actually, these are not true cysts. What these actually are images of failed matured eggs. So when it comes to PCOS, how might we investigate that someone has PCOS? The first thing you'd want to do is take a history or to do a consultation. And what you can identify importantly here is that the patient is having irregular periods. The second thing is by exploring their hormones. In PCOS, what we often see is high levels of testosterone, high levels of LH, the hormone, and going back to AMH, what we actually might see sometimes is very, very high levels of AMH, indicative of a high ovarian reserve. The third thing you can do is also do an intravaginal ultrasound scan. This will reveal that the ovaries have a polycystic appearance. It appears as though there are multiple cysts in the ovaries. Another hormonal abnormality that can cause someone to not ovulate is called hypothalamic amenorrhea. And if we break these words down, hypothalamus is just a part of the brain where hormones are released, and amenorrhea just means you're having absent periods. Hypothalamic amenorrhea just means the cause of your lack of periods has something to do with that part of your brain not releasing hormones in the way that it should. So under normal conditions, the hypothalamus is very good at just sending out hormones to send out signal to the body to complete the menstrual cycle. If your body is not entirely healthy, then this process can stop. What I mean by if your body is not entirely healthy, I mean that your body can be under extreme stress, extreme dieting, extreme exercise. So doing all the kind of extremes to your body can actually cause your brain to stop sending signals to allow your menstrual cycle to be normal and healthy. And this can give rise to hypothalamic amenorrhea. The good thing about this is that this is entirely reversible when your body is no longer under extreme stress. And when I say extreme stress, it's really subjective and depends on the person. I don't mean that you have to be going through the worst thing in the world. In my personal case, when I'm going through a breakup, my period disappears for months and months and months at a time. You know, we say mindfulness and make sure you take care of your body and your body's a temple and all of that stuff, and it sounds kind of cheesy and like holistic BS sometimes, but actually this is real. When you are stressed, your periods can stop, and it stops because of something called hypothalamic amenorrhea. The more you know. And then lastly, I'm just going to summarize some other hormonal issues that can give rise to your periods disappearing and you not ovulating. So prolactin is usually a hormone that's released when you're breastfeeding, and it allows milk production in your breast. Sometimes there can be an issue in the brain that can cause hyperprolactinemia. So if we break that word down, hyper means too much, prolactin is the hormone, emia means in your blood. So hyperprolactinemia means you have too much prolactin hormone in your blood. And the way that this manifests clinically is that you will get a woman who's not breastfeeding, who's not pregnant, who shouldn't really be having any milk production in her breast, complaining that there is milk leaking from her breast. So when this happens, it might be that she has too much prolactin hormone going through her blood. This can be because of an issue within the brain in the area where prolactin hormone is normally produced. When it comes to thyroid hormones can actually interfere with ovulation. The condition hypothyroidism is something that can actually interfere with ovulation. So if we break that word down, hypo means too little. Thyroidism obviously has to do with your thyroid gland and thyroid hormones. Underactive thyroid gland for one reason or another. And when this happens, it can actually stop ovulation from occurring. So the kind of symptoms that someone with an underactive thyroid might experience are swelling in their neck where the thyroid gland normally is, feels cold all the time, gaining weight very easily despite not actually eating more than they usually do. Someone might have little energy, feel tired all their time. These are questions that would be asked if you went for an initial consultation. Ask if you're experiencing any of these symptoms, and of course a blood test would also reveal whether you have too few thyroid hormones. So I mentioned before, we actually need the sperm cell and the egg cell to meet in the tubes of the female and then travel down to the womb to implant. There can be structural problems within the tubes or the womb of the woman, which can cause difficulties when it comes to fertilization or implantation. So all of these structures need to be normal and healthy for a pregnancy to occur in the first place. You need to have normal ovaries that release eggs. You have to have normal tubes in which the sperm and egg cell can meet. And then you need to have a normal womb in which the fertilized egg can implant. In some cases, these tubes here are blocked and scarred up, which can make it difficult for the sperm cell to make its way up the tube, but also the egg cell to make its way down the tube. One of the most common, frustrating, and preventable causes of scarring in the tube is actually as a result of having a sexually transmitted disease or infection that wasn't cleared up and picked up early enough, namely chlamydia or gonorrhea. If someone has chlamydia or gonorrhea, damage can occur to the structure of the female anatomy. The body's really good at healing itself, but these scars can cause blockages within the tube. It can cause adhesions within the tube, so two bits of scar tissue sticking together and causing a blockage to the tube. And when this occurs, it's so much more difficult for the sperm and the egg to meet. Another cause of having adhesions and blockages in the tube can include having had previous surgeries to your tube. And of course, if your tube has ever been removed secondary to an ectopic pregnancy, that tube is no longer viable. So when it comes to the womb, fertilized egg cell can implant itself into the womb. Sometimes there are structural abnormalities within the womb that can prevent this from happening. One of the most common ones includes fibroids, and fibroids is unfortunately something that tends to affect Black women disproportionately compared to other races. So if someone has structural abnormalities like fibroids or polyps in the womb, this can actually complicate the attempt of getting pregnant. And so people who have these structural abnormalities will struggle with fertility a bit more than a normal healthy womb. How might this be investigated? This is not something we can simply do a blood test for. This is something we have to visualize by doing different images. And when I say images, I mean like scans. So there are different types of scans that we can do to achieve this, but essentially we need to take a picture of the female anatomy to detect whether there are indeed any structural abnormalities present there. So I've mentioned lots of different causes that can give rise to infertility, and I've also mentioned lots of investigations that someone might want to undertake. And I just want to quickly summarize what steps are taken when you do eventually go and see a doctor to discuss these issues that you're having. So the first step you want to take is doing a consultation. And the consultation is there to get a picture or an idea of your symptoms, your clinical status, your past medical history, and all of those things, to kind of tie that together with the test results that you do in step 2 and 3. Step 2 is to do a blood test, and the blood test really tells us about all of those hormones that we've discussed that could tell us about where the issue might be lying, that would be tested for in the blood test. The last step is to actually do some imaging and some scans. It will actually be the consultation and the blood test that will tell us if a scan needs to be done and if that's going to confirm any suspicions that we have about where the issue might be coming from. Now that you know what investigations can be done, who do you go to? Where do you go to get these investigations done? So you have 3 main options, and let's start with the NHS if you're living in the UK. So the NHS is a healthcare service that will investigate these issues for you free of charge. However, the NHS does operate under certain conditions. The first thing that they'll want to gather is how long have you been trying for? And so if you do not meet these conditions, or at least it's revealed in your consultation that these conditions are not met, then unfortunately the NHS would not step in until those requirements are met. And so although the NHS is an option, it's not technically an option available to all of us. It's an option available to those of us who meet those criteria. So now let's say you don't meet these criteria and you're still a bit worried, or you just want to know. You're nowhere near having kids, but you just want to know. What is then your option? So you have 2 options available to you. You can go to a private clinic, and if you go to a private clinic, you're paying for your health service. So because you're paying for your health service, there is not this strict requirement, because they have a less less of a pressure to balance benefit versus costs because you're paying for the service. And so if you want to investigate your fertility status, then you're free to do so at the cost of whatever private clinic you choose to go with. The last option that I want to discuss with you is an option that takes into account the initial consultation where a history is taken and they ask you lots and lots of questions to get a bit of context about where you're at, what your motivations are, and then the blood test, which we saw tests for a lot of different hormones in your body that are linked to fertility and potential fertility issues. This is a home fertility testing kit. And this is a nice segue into introducing a company called Fertility. Fertility is a company that does exactly this. So you can order this kit online. You'll essentially have an online consultation where you will fill out answers to all of these questions that you would be asked if you either go to an NHS doctor or a private clinic doctor. And then they send you a home testing kit where you're able to take a small blood sample from your finger, so it will be a finger prick that you do at home, and then send the sample off to a lab where it's investigated for all of the hormones, and then together with the consultation that you did online can paint quite a good picture about what your fertility status is like at the moment and potential problems that might be causing infertility or might cause infertility in the future. This video is not sponsored by Fertility. Fertility was something that I came across myself. So I reached out to Fertility and told them, look, I make YouTube videos on women's health. I'm really interested in these kind of topics and I'm interested in making a video on fertility, and they were kind enough to send me a free box. I can confirm I've completed the test, I've received my results, and I'm going to make a whole separate video about my own personal fertility. So in terms of the cost of this testing kit, this test costs £149. So this covers the cost of the step 1 initial consultation and step 2 of the blood testing for hormones. So if we compare that to the cost of going to a private doctor for someone who doesn't qualify for NHS free investigation, then this actually saves hundreds of pounds. So I went online and tried to find the prices of what it would cost me to go to a private doctor to do these kinds of investigation. And the thing with private clinics is oftentimes they don't disclose their prices online. You kind of have to book a consultation to discuss your needs before a price is given. And I think this is mainly a tactic to not put you off an extortionate price. But there was a private clinic that I found that did a cost breakdown. And these are the total added up costs that would be involved in doing the step 1 consultation and step 2 blood test. Compared to the fertility testing kit, which tests for the exact same things, you're saving yourself a lot of money. Compared to the NHS, however, you're obviously spending £149. And actually, this is a point that I really wanted to make in an unbiased way. And this is a reason why I'm quite hesitant on actual sponsorships, which kind of confines you to speak about a product in a certain way, especially within the realms of this topic, something I'm not willing to do. So I'm going to say in a complete unbiased way, going to the NHS is cheaper than buying a fertility testing kit because the NHS is free. Only thing is, with the NHS investigations, you do have to meet certain criteria, and this excludes a massive population of women who are just curious about their fertility status and don't necessarily want to try to have kids for a year before doing so. It depends on what your motivations are. I'm going to make a video about my experience of actually doing the test and what the results were, but I definitely just want to give you the options of the NHS, going private, or doing a test at home. And with regards to doing a test at home, Fertility is the only company that I'm currently aware of. So I'll leave a link down below so that you can buy your own test. But this is going to be a whole separate video about my test and my results and my fertility. So I hope this video has been super helpful for you. If it was and you want to see more content like this, definitely like, comment, subscribe, the whole 9 yards. And I'll see you in the next video where we talk about my fertility. Bye.